After a brain injury, people often feel depressed, and depression hurts. After a brain injury, life can be more of a struggle, whether the injury is from trauma or a stroke or some other cause. It can make life more difficult. It can be difficult for the survivor, it can be difficult for the caregivers, and that can lead to depression. So what exactly is depression? And even more importantly, how can we help it? Having a brain injury can make you sad, but depression is more than the sadness. Depression is loss of hope, deep sadness, despair. Depression just doesn't go away in a few weeks. To be really to be called depression, it needs to last for more than 2 weeks. So what are some of the symptoms of depression? Feeling down, sad, or hopeless. Loss of interest or pleasure in activities that you usually enjoy. Feeling worthless or guilty. Trouble sleeping or sleeping too much. Changes in appetite with weight loss or gain. Loss of energy or fatigue. Difficulty concentrating or making decisions. Withdrawing from others. Moving or talking slowly. Feeling restless and fidgety. Thoughts of death or suicide. So, how do you get help for depression? First of all, know that there is help for depression. There's people that can help you, and that there are things that you can do to improve. If somebody says just get over it, that's probably not gonna work. We just don't just get over depression. Also, some people feel that to get help for depression is a weakness, or depression is a weakness, or that it's their fault. Depression isn't a weakness, and it's nobody's fault. It is a normal human response to difficult times and difficult events. First, if you have thoughts of suicide, get help right away. You can call a local crisis line. You can call 911. There's a 24-hour national crisis hotline at 800-273-8255. Or go to an emergency room immediately. So what are some of those things that you can do to help? First of all, medications and counseling are both helpful for depression. Antidepressant medications can help depression by rebalancing the neurotransmitters in the brain. Counseling or psychotherapy can be really effective for depression. There are different techniques that counselors use to help depression. The techniques can focus on either day-to-day behavior or thinking patterns. Sometimes a combination of the two is helpful. Here's a few things that you can do each day to help depression. Set some goals each day. Do at least one thing that you enjoy. Exercise each day. Exercise can really help depression. Socialize. Being around people you enjoy helps. Attend a brain injury support group. Eat healthy. Get better sleep by going to bed and waking up at the same time each day. Challenge negative thinking. Depression colors our thinking. It impacts the way that we think about things. We tend to think more negatively about things and about ourselves when we're depressed. Thinking patterns can be changed. It can be hard to change thinking patterns. Our brains tend to not want to change how they think. A counselor can really help with this. So who can help with depression? Mental health professionals. Psychiatrists often prescribe medications for depression. Psychologists, Social workers or other licensed counselors can help with depression. Primary care physicians can help with depression. Physiatrists can help with depression. Try to get providers who have experience in treating brain injury. For more information about depression, you can contact the National Institute of Mental Health. So remember, depression after brain injury is common. Depression hurts, and there is help for it.